Let's get started, everyone. Well, thank you all again so much for joining us tonight to learn a little bit more about ketamine-assisted psychotherapy, or KAP, and medication management here at Journey Clinical. We are so happy to have you tonight to talk just a little bit more about our safe and evidence-backed care that's designed around your mental health and supporting your goals. So just to talk a little bit about what this presentation is going to cover today, we're going to start off by explaining how CAP might be able to help you in your specific situation and any mental health diagnoses that you might be looking for support. We're going to then transition a little bit into what your CAP experience will look like and really how the process works here at Journey Clinical. We're then going to touch on how to begin care depending on where you're coming from and how you found out about Journey Clinical and our treatment plans. And then we're going to save some time at the end today of this presentation to answer any questions that you all might have in our Q&A section. So if you all want to check real quick, there should be a bar at the bottom of your Zoom that where you can input any Q&A questions, and we'll make sure to get to all of those questions at the end of the presentation today. So feel free to ask those questions right now or at any point during the presentation when they do come up, and we'll make sure to get to them at the end. All right. Well, to kick it off, I'd love to introduce myself. My name is Will Vaxmonsky, and I am a patient care specialist here at Journey Clinical. Basically, what that means is that it's my responsibility to answer all of your questions about getting started with treatment here, whether it be insurance coverage, cost, what the process looks like, what I can expect, how I can find the right therapist for me. I talk to patients every day and answer those questions for them to make sure that they feel comfortable and confident in getting started with care with us. I also host free introductory calls with patients in which we can discuss any of these questions one-on-one to make sure that we can find the care plan that meets your specific needs. And I'll make sure to put that link in the chat later on in this call so that anyone who does have lingering questions can book a call with me and we can make sure that you feel ready to get started with us. I'd also like to let Dr. Gordon introduce herself. She's a member of the leader of our wonderful medical team here at Journey Clinical. So, Bridget, do you mind introducing yourself for everyone?
Not at all. Thanks, Will. Yeah, I'm Bridget Gordon. I'm a doctor of nursing practice, an advocate for and expert in ketamine treatment, and I'm the lead clinician, as Will said, here at Journey Clinical. And I specialize in safe psychedelic practices, and I'm dedicated to ensuring that all the medical team is properly trained and capable of safely and compassionately supporting our patients throughout their entire healing journey. And I'll be talking to you more today about ketamine assisted psychotherapy.
Awesome. Thank you, Bridget. So we'd love to start the presentation part of today by just asking you all a few questions to get to know you better. So we want to start by just asking, how familiar is everyone with CAP coming into this info session today? Hopefully you're here to learn a few different things, and hopefully by the end of the call you will. But we'd love to get an idea of where you're at right now. Awesome. It looks like we have a pretty good spread of people who are learning about CAP for the first time and people who know some things and are ready to learn a little bit more or are already pretty familiar. So we're so glad that all of you took time out of your night to join us and to just get a little bit more familiar with CAP and how the treatment works here at Journey Clinical specifically. We'd also love to know how all of you found out about this event. We love, being able to put on educational events for patients just so that they can get a better idea of what care options are out there for them. So we'd love to know how you heard about this event so we can make sure we can reach patients who are looking for ketamine-assisted psychotherapy or medication management and how we can best reach them. Awesome. It seems like most of y'all are here from your therapist, so that's wonderful. We do have a wonderful network of therapists who are so eager to, share CAP and medication management with their patients and make sure that they get the psychiatric support that they deserve. But moving on, I'm going to hand it off to Dr. Gordon to ask one more question, and then we'll dive deeper into the presentation part of this info session.
Yeah, absolutely. So let's start by talking more about what brought you here to consider CAP. We always like to get a sense sort of for what brought our audience tonight and what's interesting you about CAP. So you'll see the poll pop up again on your screen. And you can actually select as many answers as apply, and your response will be completely anonymous. Okay. I see some people feel a little stuck. Some people are saying they feel some burnout. Okay. So all really good reasons, all really good reasons to come to Journey Clinical to find more out about ketamine-assisted psychotherapy. Okay, so let's move on. So if you are feeling stuck, um, if you're experiencing anxiety, depression, or have been diagnosed with PTSD, you're looking for safe, evidence-based treatment options beyond traditional psychiatric medications, want to address the root causes of your symptoms, are curious about how psychedelic assisted psychotherapy could help you, then CAP really might be a good fit for you. By now, you know that CAP stands for, well, maybe you don't know by this point, but if you don't already, let's go over again that CAP stands for ketamine-assisted psychotherapy. But you still may be wondering what that actually means or looks like, and we'll now dive into the details of CAP. Okay, so CAP is the combination of both ketamine, which is prescribed off-label by a medical professional to eligible patients, and psychotherapy with a licensed mental health professional. So combining these two together can create greater efficacy and lead to better outcomes than either one alone. So let's start talking first more about ketamine specifically. So ketamine is an FDA-approved medicine classified as a dissociative anesthetic, which was initially approved for anesthesia about 50 years ago. And it's an extremely safe substance on the list of World Health Organization's list of essential medicines. And those medicines that end up on this list are selected for a number of reasons, including being safe, effective, and cost efficient, which is extremely important to us. Although ketamine was only used as an anesthetic for some time, in the early 2000s about, a few studies were done to validate evidence that it helped alleviate depression and suicidal ideation. So this then opened up the doors for more studies, and now thousands of studies that have shown ketamine's effectiveness for treating many concerns beyond just depression, and beyond suicidal ideation as well. It is now prescribed off-label for a variety of mental health challenges, including, but really not limited to at all, PTSD, anxiety, OCD, substance disorders, and more. So how is it that ketamine can be so useful for such a wide array of mental health concerns? It seems too good to be true. And how does ketamine exactly do what it does? So in essence, ketamine works at the nerve wiring level, whereas most often typical antidepressants work at the neurotransmitter level. So there are about a dozen neurochemical processes that ketamine activates, but in short, ketamine leads to a few downstream effects, which can lead both to new neurons, something that we call neurogenesis, and strengthens connections between existing neurons, which the combination of these things we call neurogenesis, and the strengthening of connections, neuroplasticity. But what does neuroplasticity actually mean for you and for your mental health? Multiple things. So by fostering neuroplasticity, CAP helps you to get to the root of mental health concerns. It promotes neuroplasticity by rapidly enhancing synaptic connections. So areas of the brain that allow more connectivity and more communication. And this allows patients to access and reprocess the root causes of mental health concerns with greater flexibility and emotional openness. It helps process difficult emotions and trauma, break habitual thought patterns, create new, more adaptive thought patterns, as well as finding new clarity and hope, as well as hopefully hope. Um, I always think it's helpful to hear in our patients' own words what KAP has done for them. So we'll look at two quotes here. One of our patients has shared, "KAP has truly freed me up to experience more joy in life. It's helped me to see things I'm struggling with from a place of confidence and security." Another one of our patients wrote, "It felt as though I had been gifted a fresh perspective on life after completing those sessions. I never imagined I would experience such a profound transformation in my lifetime." That's really lovely. We also hear about the power of KAP from our member therapists. So, from the therapy side, um, one therapist explained, "My clients have tried all kinds of medications and treatments, but they just keep hitting a wall. KAP allows those who feel stuck to go to the next level and to do this with deeper work to access grief, trauma, and find new breakthroughs." And I can certainly attest to that as well. While we consistently hear how impactful KAP is from our patients and therapists, we also see these results in the data we collect from our thousands of patients' clinical scales. We're extremely proud to share that 87% of our patients improve their depression and anxiety clinical scales after an initial course of KAP, which is incredible. And 40% of patients experience complete remission from their symptoms. And as someone considering KAP, you're likely aware that there are different mental health treatments out there, and there are even different options within ketamine treatment, from in person ketamine clinics to at home ketamine treatment without psychotherapy. And what I hope to share more about in the next few minutes is what we do differently at Journey Clinical to make our patients' outcomes, these amazing patient outcomes, possible. So let's start with a bit of an overview. In contrast to other ketamine treatments out there, you'll work with a licensed psychotherapist throughout the KAP process, and you'll work with our expert medical team. Your therapist and your medical provider will also be able to work with one another regarding your care, and we refer to this model as a collaborative care model. We'll cover this in a little bit more detail in a moment, but here at Journey Clinical, you do have the option to choose in-person or remote ketamine-assisted psychotherapy. Ketamine clinics require you to be in person, and at-home ketamine treatment provides you with only the option to be at home, as the name suggests. But we offer both. We think that's important for the convenience and to foster an experience that will feel most comfortable for you. And as we talked about earlier in the presentation a little while ago, ketamine helps you to create new neural pathways and approach problems in novel, so different ways than you have before. While talk therapy on its own can be tremendously useful, we often hear from patients and therapists alike that while talk therapy isn't enough to get certain patients out of a feeling of stuckness or able to connect deeply to the root of those issues. So combining ketamine and psychotherapy can really do just that and is considered the gold standard of care. I also want to share about our psychiatric medication management service that we have available. Not just ketamine-assisted psychotherapy, it's a combined, medication management with also ketamine services as well. So our medical team can support you by assessing the need for and prescribing, traditional psychiatric medications like antidepressants, anti-anxiety medication, or stimulant medication for ADHD, for instance, in addition to ketamine, as I said. So this service is no additional cost to you if you're already doing KAP, which is great. regarding insurance, Will's going to go over all of this in more detail in a moment, but we are incredibly proud to share that we do accept several major insurance providers in most of the states in which we operate to help keep care affordable, which is super rare with ketamine treatment. And last but certainly not least, you can expect deeply compassionate medical care here. We regularly hear from our patients that the provider that they saw at Journey Clinical was the most empathic and professional psychiatric provider that they'd ever seen, which is so great to hear. And 95% of our patients rate their provider 5 out of 5 stars. We really do feel confident that you'll feel the same level of respect, warmth, and care. Okay, so now moving on. Now let's look at a few of the key features of KAP at Journey Clinical in a bit more detail. So first and foremost, we can't overstate the importance of psychotherapy in the KAP process enough. Here at Journey, we consider psychotherapy not to simply be an adjunct to ketamine treatment, but an integral part of the entire KAP experience. Having an established positive relationship with a therapist in which you collaborate on your treatment goals together creates the necessary feelings of safety and support, really to do the deep work and inner reflection and often quite vulnerable emotional processing. Additionally, your therapist is there to monitor your safety before, during, and immediately following your dosing sessions. Now that we've talked about some of the core features of KAP at Journey Clinical, let's dive into the deeper KAP process and timeline, as I'm sure you all are wondering if you would be a good fit and how it would how it would fit into your schedule and into your life. Okay, so many patients come to Journey Clinical, like some of you who already work with a Journey Clinical therapist, and some patients come to us without a Journey Clinical member therapist. If that's you, we'll match you with one of our members based on your needs, preferences, and budget as well. It's quite very important. Then you and your therapist will prepare for KAP. This starts with you having a 1-hour appointment with our medical team where we'll determine your eligibility for KAP. If you're determined ineligible for whatever reason, you'll receive a full refund. If you are cleared for KAP, your ketamine prescription will be sent directly to your door, and you and your therapist will start to have preparation sessions following to discuss the goals, set your intentions for your first session. And this preparation process typically takes about 2 to 4 weeks. Next, you'll enter the main phase of KAP, during which you'll have about 6 to 8 ketamine dosing sessions. After each session, you'll have what we call an integration session, which looks like a standard therapy session, but it's an opportunity for you to process and reflect upon your dosing sessions. After your first 2 dosing sessions, you'll have the 30-minute follow-up medical appointment that I mentioned, and this will give you the opportunity to check in with your medical provider, make prescription adjustments if needed, and generally just discuss how treatment's going. Okay. And then these 6 to 8 dosing sessions are followed by integration sessions and the follow-up appointment. They generally take place over the course of about 3 months, I would say, depending on how frequently you have your dosing sessions. Most patients will have a dosing session about every 2 weeks, but we do it as frequently as every week or even sometimes twice a week. So after your initial 6 to 8 dosing sessions, you and your therapist will collaborate to determine the best next steps for you. Some patients will feel like they're in a great place and ready to conclude KAP. Others will continue with another course of KAP for greater symptom relief, or mental health maintenance. I have some clients that have been in maintenance for quite a long time after the initial 6 to 8 sessions because it's really moving the dial for them as far as their mental health treatment ongoing. So it really is different for everybody. I mentioned medication management previously, and I'll bring it up again here just to share that medication management is always available to all of our patients, in addition to or also in place of KAP. So medication management is not an additional cost if you're already going through ketamine-assisted psychotherapy. Okay, so what I shared may have sparked some questions for you about the dosing sessions, and this is often the part of the process that we get the most questions about. So let's dig into the details of the dosing sessions. Great. First of all, you have options when it comes to where and how you do CAP. So there are two ways that dosing sessions can happen. The first is in person, where you're with your therapist in their office. The second way is remotely, where you're in the comfort of your own home and your therapist is present with you the whole time through a video call using a platform like Zoom. In these remote sessions, a chaperone is required, someone who simply needs to be available in the residence, although not necessarily in the room with you, just in case you need some physical support, for example, if you need to be handed a blanket, a tissue, water, or be helped to ambulate to the bathroom. You might also be wondering about the form of ketamine that we prescribe, which is important so that you know what to expect. So we prescribe what's called a rapidly dissolving tab, or RDT. We call it RDT, that you'll place under the tongue. And we use weight-based dosing for guidance. And once we've determined your initial dose, we'll prescribe that dose in 2 tablets. This allows you to work your way up to a full dosage, sort of dipping your toe in, making sure that it feels comfortable, especially in that first dosing session, so you can really safely ease into it. You'll also be provided with what we call a booster tablet, which is a completely discretionary tablet, meaning you have the option of using it along with your full dose if you so choose. And you would sort of fill that out with your prescriber and with your therapist when you're having the experience, to know if maybe you need to have a little bit of a higher dosage based on how you feel. Our medical team will go into a fair bit of detail at the evaluation and follow-ups, laying out all of the different options that you'll have for self-administering the medication based on this 3-tablet availability to you per dosing session. And all medication will be shipped to you directly. Okay, let's get into the actual dosing session. So after taking your blood pressure and your heart rate or your pulse and self-administering the medication, you'll lay back in a comfortable position. You'll wear an eye mask to encourage more of an inward focused experience. The goal is to allow you the space to be internally reflective and present with anything the session might bring up for you, while listening to gentle instrumental music that we know from literature really does support the experience a great deal. And this will all be done in the presence of your therapist, who will be available to support you through anything that you might need during this period. That's what they're trained to do. That's what they're passionate about. After the acute effects of the medicine wear off, which will be about, on average, 45 minutes. It's different for everybody, but on average, 45 minutes. You'll then be able to sit up, take off the eye mask, and have some time to discuss and process your experience, maybe have a snack, and just sort of ease back into life. A question we often hear from prospective patients is, what does ketamine feel like? Great question. And everyone's experience is a bit different, and you'll likely notice that each of your dosing sessions might actually feel a bit different from the last one. So there's really no one size fits all description for a dosing session, which makes the experience all the more interesting. With that being said, many clients describe the experience as dreamlike, that they might feel far from their body. You might notice more contour around your imagination when your eyes are closed, and when your eyes are open, you might notice more saturation in color or sharpness around the edges, feeling pleasant, relaxed, and may notice an immediate lift in their mood. But as I've alluded to, the real magic doesn't necessarily happen in the dosing session itself or even immediately after. It's the gradual neuroplasticity and rewiring of old thought patterns over time that creates lasting change. And what's so important is the sandwiching in of your dosing sessions with integration. And on this note, I'll leave you with the words of one more of our patients as they reflected on their CAP experience. And I'll read it. CAP therapy opened up a door when I was running into a wall. I no longer needed to carry the weight of my experiences. I no longer needed to be immersed in guilt and shame. It has opened my mind, helping me peel back the layers like an onion, creating aha moments so inner peace and self kindness could begin to flow. I'm grateful. So nice. And with that, I'll pass this over to Will and who will talk more about cost and insurance.
But yeah, let's dive into cost and insurance to make sure you all have a good understanding of what you can expect from treatment here at Journey Clinical. Um, so I want to start by just saying we do accept insurance here at Journey Clinical. It's always our goal to make care as accessible as possible to our patients, and we want to make it as easy as possible for you to explore your coverage. And so what we want to do is just put a link in the chat real quick. If you see that link that popped up in your chat, you should click that form. And what it'll do is ask you a few questions, just your state and your insurance provider. And we'll actually be able to tell you live on the call whether or not you have in-network or out-of-network coverage with us here at Journey Clinical. If you're not planning on using insurance, you can still feel free to use that form and just put down that you're not planning on using insurance. And we do accept cash pay, so that's not a problem. But if you do have insurance that you plan on using, please just take 1 minute to fill out that form. And then we'll be able to get a better idea of what your coverage might look like for the rest of this presentation. So I'll give everyone just 1 minute to fill out that form. And then after that, we'll dive a bit deeper into what those benefits mean. Awesome. Hopefully all of you have submitted the form or are in the process of submitting it. But as soon as you do, it should take you to a screen and if that screen tells you that you are in network with Gen Clinical, that's great. That means that your insurance will be directly applied to your medical appointments. And that just means you'll just be responsible for any non-covered services, as well as any specific copay, co-insurance, or deductible that is applicable to your specific insurance plan. Even if you aren't in network, if that form did tell you that you have out-of-network benefits, that's still great. We make it super easy for all patients to submit super bills to their insurance, which is basically just like a receipt of services that you submit to your insurance provider, and they reimburse you after the fact for the cost of those appointments. And I'm happy to say that many of our patients get anywhere from 60 to 80% reimbursement on those super bills, which makes care a lot more affordable and accessible to many of our patients. And if you have any questions about your specific out-of-network coverage or your insurance coverage in general, we strongly encourage you to send an email to our insurance and billing team. You can see that email right here, patient-billing@journey.clinic. Feel free to write that down or take a screenshot of this page and send them an email, and they'll be able to perform a free check of your specific coverage and be able to give you an exact overview of what's covered and what you might expect to pay out of pocket, just to make it as transparent as possible for you. So I'll just wait 1 second for everyone to write down that email if they are interested in checking their specific coverage. Um, and then we'll move on. Awesome. So now that we have a better understanding of what insurance you might have and what might be covered, let's dive a little bit deeper into where that insurance might apply and what are the expected out-of-pocket costs. So to really understand this, you have to understand that there are two sets of costs associated with CAP treatment. The first set is the costs that are paid directly to Journey Clinical, which is the cost of your medical appointments as well as the ketamine medication. So as Dr. Gordon said earlier, you will come in and see our medical team for a medical appointment in which you will get in-depth support with your mental health. They'll be able to give you a eligible diagnosis. And as long as you are deemed eligible for CAP, you will receive your ketamine prescription. So the cost of that first medical appointment is covered by insurance as if you are planning to use it. If you're not planning to use it, then the cost of that first appointment is $250. And during that intake appointment, as Dr. Gordon explained earlier, you'll be prescribed your first 2 doses of medication, which will be paid out of pocket, and that will cost $112 at your first appointment. And then when you're ready to come back for your follow-up, again, you'll have that follow-up appointment. If you're using insurance, it will be according to that plan. If you're not, then it will be $150 for that follow-up. And then when you're prescribed 6 additional doses during that follow-up appointment, that will cost $208. Now, separately from the cost paid directly to Journey Clinical, there is the cost of psychotherapy. Many of you mentioned earlier in this call that you already have a psychotherapist that referred you here. And so that's great. If you already have a therapist, you would just continue paying them according to their rates. If you don't yet have a therapist for the psychotherapy portion of treatment, we'll make sure to help you find a therapist who accepts your insurance and fits within your budget to make care as accessible as possible for you. We also like to show patients what all is included in this treatment plan and really what it breaks down to on a more regular cadence. So you will receive comprehensive psychiatric evaluation and ongoing care from our dedicated medical team. You'll also receive collaborative care with your medical team, your specific psychiatric provider, and your therapist. We offer all of that within our network and make sure that all of your mental health can really be held under one roof. We also offer fully supportive medication management with care for follow-up and adjustments, both to ketamine prescriptions to make sure that that ketamine medication and the dosage of it is as effective as possible for your treatment plan, as well as any other psychiatric medications that you might be taking, for example, SSRIs, anti-anxiety medication, to make sure that you feel fully supported by our team. You'll also receive a personalized treatment plan designed to help you feel better. Um, and all of this will breaks down to about $18 to $40 per week, and that is just dependent on your specific insurance plan and what benefits you might have. And again, the therapy fees are paid separately to the therapist directly. Great. So now let's talk a little bit more about your next steps towards getting started with care. So if you already have a therapist who is a Journey Clinical member, the first step is just to tell your therapist that you're ready to get started. They'll take the next step of referring you through our online platform. And as soon as that referral is submitted, you'll receive an email prompting you to log in and access your patient portal. That patient portal will be your home base for all of care. As you can see in the bottom left-hand corner, that'll be exactly what it looks like when you log in. Get started with ketamine-assisted psychotherapy. You'll click that purple continue button, and you'll be able to fill out a few intake forms and then book your first appointment. If you don't yet have a Journey Clinical member therapist, that is perfectly okay. You can fill out this quick eligibility assessment form right here. I'll also post that link in the chat real quick for anyone who is ready to fill out that form. So you'll fill out that quick eligibility assessment, and then you'll be able to log in and access your patient portal, which again is your home base for all of treatment and where you'll be able to book that first appointment to assess your eligibility. And after that appointment is booked, our dedicated therapist matching team will reach out to you to make sure that we can get you matched with a local therapist who accepts your insurance. We have a wide variety of therapists that cover a wide variety of specializations, and we will take all preferences that you might have, whether it be in-person versus remote sessions, any gender preferences, any location preferences. We can take that all into account to make sure we can get you matched with the right therapist for your KAP treatment. I want to thank everyone for being here and learning a little bit more about ketamine-assisted psychotherapy with us tonight. If you do have any more questions or any questions come up from now until when you're able to meet with one of the members of our lovely medical team, like Dr. Gordon, I'm just going to post a few more things in the chat just to make it as easy as possible for y'all. I'm going to first post our patient care team's email. If you have any questions from me and our team, feel free to send an email there and we'll be happy to address them. Again, if you have any questions about billing or insurance, you can always email patient-billing@journey.clinic and they'd be happy to give you some clarity there. Third, if you'd like to have a free one-on-one introductory call with me, we can answer and talk about any questions that you might have had that came up during this call or anything that might be lingering that you just haven't quite gotten your answer figured out. or if you just want someone to talk to before getting started, feel free to click that link, journey.click/intro call. And we'll make sure to, answer any questions that you might have and to make sure that you feel comfortable and confident in getting started with treatment here. So thank you all again so much for joining us tonight, and we hope you all have a wonderful rest of your week.